The advantages of continuous intraoperative monitoring of ECG and blood pressure and having a venous access during any surgical procedure is not hard to understand. It provides the easy administration of intravenous drugs in case of an emergency. Moreover, you can also give intravenous drugs for inducing sedation, if you want to sedate the patient before or during the surgery. What kind of intraoperative monitoring do you do while operating on your cataract patients? Do you regularly put an intravenous line and record ECG of the patient while performing the cataract surgery? If the answer is no, then you are not alone. In this video, we will discuss the practice of continuous intraoperative monitoring of ECG and blood pressure and having a venous access during routine cataract surgery. But first, we would like you to subscribe the channel so that you may not miss our new videos. You may also share the video with those who may like this topic. Check the description for similar videos and product links. Share your views in comments if we have missed anything about this issue, which will help the community. Cataract surgery is the most prevalent surgery of all medical fields. It is consistently performed throughout the world with a high success rate. There is a lot of standardization in terms of surgical techniques and the disposables like blades and phaco probes used in cataract surgery. But the same cannot be said for the practice of patient monitoring and intravenous access during the surgery. It varies according to surgeons' preferences, institution and country regulations. Recent study published in the prestigious British Journal of Ophthalmology has tried to find the patterns of intraoperative monitoring during cataract surgery. Across the world, the researchers conducted an online survey to get an idea of this practice. Survey included 240 leading ophthalmologists working in different centers in 38 countries and 5 continents including India. What they reported in the study was not surprising at all. The practice of intraoperative monitoring during routine cataract surgery is highly variable. Only 2 out of 3 ophthalmologists surveyed agreed to the fact they routinely put a vascular access during the cataract surgery. Almost a similar number of ophthalmologists said they routinely perform ECG on their patients while operating for cataract. Just think about it, 1/3 of ophthalmologists either do not do any kind of monitoring of patients or do not have any venous access during cataract surgery. If you have an intravenous access during the surgery but do not have the ECG monitoring of the patient, it is of hardly any use. In the absence of monitoring, the intravenous access can only be used for giving fluids, or at the most, the intravenous sedation. Even that can be avoided as you always consider oral drugs for sedation. Similarly, doing ECG monitoring without venous access is not very useful either. In the event of a cardiac emergency, there is no venous access to give the drugs quickly. Now the question is, do we have any recommendations in this regard? The answer is yes. It is recommended that continuous monitoring and a vascular access during cataract surgery is advisable and is reported to be a cost-effective measure in improving patient safety. But despite the existence of guidelines and scientific evidence, there seems to be little consensus on these key issues. Hopefully, best practices for intraoperative monitoring and intravenous access during cataract surgery will be defined soon, as there is a huge caseload and there are serious medico-legal implications in the event of a complication. I hope you liked the video. Feel free to share your views on this issue in the comment section. Check the description for similar videos and product links.